Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Dr. Odera Mbanugo of Aultman Medical Group, Canton South Medical Center. Good morning, doctor, and welcome to the show.
All right, thank you for having me.
All right. Aultman Medical Group Canton South Medical Center focuses on total health care, whether an individual patient or your entire family, treating acute and chronic health problems while providing annual physical examinations and performing tests to detect health issues early. The family practice physicians provide child services, immunizations, sports physicals, allergy injections, lab services, and much more. We'd like to remind our listeners today our program will be available on our podcast. Just listen for Health Matters with the Medicine Center Pharmacy, and you can search that in your favorite podcast app, and please subscribe to our program.
Again, Doctor, welcome to the show. Please tell our listeners about yourself and your role at Aultman Medical Group, Canton South Medical Center.
All right. So once again, I'm Dr. Mbanugo. I'm one of the new family medicine physicians. I've been working in this office since early, I would say August of last year. I grew up in Canton, Michigan, ironically enough, and here I am in Canton, Ohio. I trained in Midland, Michigan. Married for about 2.5 years, have a 1-year-old daughter. I'm a Michigan State fan, because that's usually a question I'll get from patients to be friends.
It's better than Ohio State. I'm a Purdue guy, so hey, Big Ten all the
way. Okay, so is this Canton better than the other Canton?
I wouldn't say it's better, it's different.
I see. Okay.
This Canton's bigger, and yeah, I say it's bigger and different groups of people compared to that Canton. But both Cantons, in my opinion, are good. Like, I'm never going to slander where I grew up. But
Okay.
It's definitely grown on me.
I've been to several conventions up in Michigan, and one of the cities that the convention was in, it escapes me. It's been in the news a lot lately, but it is one of the cleanest cities I've ever been in my life. Not a piece of paper or Kleenex laying on the road anywhere. Grand Rapids, is that it? I think, yeah. Just amazing. I couldn't believe it. There's a French restaurant, French hotel there or something. I forget what it's called. Anyway, I thought it was a very interesting trip. So, doctor, what is a primary care provider?
So to put it in the simplest way, a primary care provider it's the first medical provider that an individual will come to contact with when they have any undiagnosed medical problem or when they have a chronic condition.
And what specialties make up primary care?
So primary care is very interesting because it encompasses 3 specialties in particular. So first you have pediatrics, which is going to be newborns up until 21 years of age. Then you have internal medicine. That's going to be anywhere from 16 years of age up to the elderly. And then family medicine, which is my craft, is more of a hybrid of the two. So I'm able to deal with newborns up to elderly.
Are there any testing or of sorts you do down there at that facility? X-ray or whatever?
So we don't do imaging. Anytime we have any imaging, we send them over to Aultman Main Hospital or over to the North Canton office with AMG. Or if they prefer, we send them to a nearby hospital like Mercy. But we do have a lab. So we do all of your basic labs, your blood count, your metabolic panel, your cholesterol. And then we also give vaccinations as well. And then
so in advance of an appointment with your office, you can also do advanced testing for blood work. Is that correct? Or do they have to go to North Canton or something?
So we actually do lab appointments. So our normal setup, it's a little different if you're a new patient and you have a concern that needs some like more immediate labs, or if you're coming for an acute concern that needs immediate labs. But normally, if you have like a chronic condition, we'll say you'll have the visit, you'll have like a 1 month follow-up, then the week prior, you'll have your labs, which is always good because patients want to be aware of what the labs mean. So it's good to be able to have that discussion.
Interesting.
Doctor, what providers make up primary care? Did you have anything else to cover based on your previous specialty details?
So I could just go straight to what encompasses like the providers. So
Okay.
you have like physicians, such as myself. Then you have nurse practitioners. Then you have physician assistants. All of us have different training. We're doing pretty much the same job, but everyone has different levels of training, and we all kind of like piggyback off of each other. And then any medical provider will tell you that they can't really complete their job without the staff. So that encompasses LPNs, MAs, RNs, and then also like phlebotomists to mention a few.
Okay. So you mentioned different specialties in primary care with pediatrics, internal medicine, family medicine. What kind of differences in the different types of patients do you see? Now, pediatrics, we understand are the little ones, but I've always been interested, I guess, in how internal medicine and family medicine kind of interact. And I wondered if you have any way to differentiate for the listeners on when you might need to see an internal medicine doctor versus your family medicine doctor.
So I'd say a family doctor, especially if you have a family that needs to be treated, is probably the more convenient of the two, because I'm comfortable with newborns, toddlers, adolescents, teenagers. But then on the same token, I'm also very comfortable with young adults, middle-aged, elderly, and essentially you can do everything that internal medicine can do, plus the pediatric component. And then depending on your comfortability, you could also do a little bit of gynecology. So not everyone does pap smears, but I was trained very well during residency on pap smear. So if a woman wants to get their gynecologic care and family med care all together and they're comfortable with it, then that's something that can be done. And at least to my knowledge, internal medicine does not have that training to do those type of procedures.
So it sounds like a lot of the experience you can share with the community also comes from the training you've had in your background,
Mhm.
your specialties, your rotations, and things of that nature.
Mhm.
Okay. So one thing that I really want you to touch on, and I actually had a conversation yesterday with a patient in the pharmacy. We are often really surprised how many patients don't have a primary care physician. Um, their first line of medical care is to go to the ER or maybe an urgent care. And I wondered if you could take a minute to share how important it is to have a relationship with a doctor like yourself, to have a primary care physician. So if you could talk about that, that would be great for the community.
So I'll start with one word: consistency. So it's good to have consistency in your medical care, because if you're seeing an ER doctor, even if you go to the ER once a month, the chances of you seeing the same ER provider and them actually remembering all of your medical concerns is very rare. So it's always a benefit to see someone that knows all of your medical conditions very well. And then you're also speaking to family medicine in particular, or even internal medicine, like we're very well-rounded physicians. So we're prepared to deal with all types of situations. And then we also know you on a personal level, which kind of helps to manage all of your health concerns.
Interesting.
I do think sometimes it helps to have that relationship because when you build that trust, you're a little more open to share what's really going on versus being maybe embarrassed about sharing that something's going on you're not comfortable with. And I think that's hard. So, I don't think anybody wants to. I don't think sometimes people want to share what's really going on if they're embarrassed about it. And if you trust your provider, you can overcome that barrier.
Mm-hmm. And sometimes And sometimes it takes one visit, two visits, three visits to kind of break that shell. But then at least you have that opportunity to, whereas like you have one opportunity as a ER doctor, and then at the same token, you might not see him again. Where especially with usually like with my first visit, it's a little bit longer so that I can kind of get to know them. And before I even dive into all their medical concerns, I'll truly ask them about like, are you married? Are you divorced? Do you have children? What do you do for work? How's your family life? Because all these things, you'll be surprised how these things really affect your mental health as well as your physical health.
Very interesting. So why is early detection and prevention a vital part of health?
So I feel believe the best form of treatment is prevention, or at least early detection, because it's better to find an illness in its early stages than to wait till it's too late when the mortality is much higher or when the complications are more severe. So if I pick up diabetes in a 37-year-old versus they've been walking around with A1C of 12%, which is very high for anyone that does not know. And then I catch them at 60, and then now they're dealing with peripheral artery disease. Maybe they're going to have an amputation of a toe. They have neuropathy. It's affected their vision. Whereas if I caught them earlier and they were seeing a primary care provider much earlier in their adult life, all these would not be a problem. Then the same token goes with something like heart disease. So heart disease and hypertension, a lot, and high cholesterol, these are silent killers. So if you allow things to kind of progress over time, you have a higher chance of mortality and morbidity versus if you started off seeing a doctor in your 20s and you kind of grew with me or grew with like whomever, just better outcomes overall.
Wow. Okay, doctor, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to a pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. So, doctor, what type of visits do primary care providers encounter?
Well, it's a wide range. So you have your acute visits. So it can be an acute sick visit. It could be a musculoskeletal complaint, where they have knee pain, back pain, and so on. A wellness visit is going to be the one that you want to really stay up on. So wellness visits are going to be once a year. And that's anywhere from, if you're talking adult wellness, it's going to be 18 up to 64. If you're talking well child, it's going to be newborn up to, we'll say 17. And then 65 and up is when you have those Medicare wellness visits. So very similar to an annual physical, but you ask more questions about like their fall risk, how they function, whether they've been taking the medications and so on, and like their active directive. And then you also will have preoperative evaluations for anyone having any form of surgery. I think if there's anything I'm missing. Those are the big visits, really. And just like follow-up, we'll say follow-ups for chronic conditions as well.
Go ahead. So what is the number one leading cause of death in the U.S.?
So that would be heart disease. So that's coronary disease, whether you're having a heart attack, any form of blockage essentially of your coronary vessels.
Very interesting. I guess I was going to think that it was cancer or something else like that, but I'm guessing that people just don't take care of their heart. I guess they really can't do much for their heart other than not eat fatty food and and all that other kind of stuff that goes along with it. And it's just the diet of most people anymore is just incredible. So we coun- we counsel people in the drugstores all the time about what'd you have for lunch, or that sort of thing. Oh well, I went down to the fast food and I got a hamburger, and oh, my dog was with me and I got a hamburger for the dog too. So it's just kind of crazy what some of the people are doing and what they're eating. So
Yeah, speaking to the diet of people, a lot of the problem that you hear from patients that they don't have time because maybe
yeah,
they like a very rigorous job, their schedule's very tough, so they just get whatever.
yeah,
Then
yeah,
other a common thing that they'll complain of is just like finances. Maybe their finances aren't right because unfortunately healthy food is more expensive
yeah. Do,
unhealthy.
do you counsel patients on weight loss and all that sort of thing? Is that a common thing?
Yes, a lot of it is almost being like a motivator of them because it's just kind of making that decision because everyone wants to lose weight, but then like anything good in life, it takes work. So motivating that, like giving
Yeah.
them steps, like okay, you don't have to do like a hit workout, but like go on daily walks with like your loved one or your
Mhm.
grandchild or like your dog. Um, Start with small changes with your diet, start with portion sizes, and then kind of move on from there.
Mhm.
Pick one food item that you know is like your vice. Everyone has their vice, and try to eliminate that.
Mm. Your voice, yeah, cookies and cake. I love chocolate cake. Anyway, okay.
All right, doctor, what's the number 2 leading cause of death in the US?
The number two is cancer. I know Paul was thinking that was one, so it's close, but cancer is number two, and that includes all forms of cancer.
Okay. So you mentioned heart disease and how much of a problem it is. It's the big number 1. Can you talk about risk factors? And we just talked a little bit about weight, but what can someone do to take ownership of trying to put themselves in the best position to reduce the risk for heart disease?
Okay. So heart disease is very multifactorial. There's a number of things that you can control, and there's some factors that you can't control. So, for example, like male gender has a higher risk of heart disease. So you really can't control if you're male or female. But then things like hypertension or high blood pressure, that's a major risk factor. So that's under control. Hypertension, a high cholesterol is a big one, of course. Um, Diabetes is a higher risk factor than people know. Sometimes people will be put on aspirin just for the simple fact of having diabetes, just because of the risk factor is so high. So that's a big one. Um, smoking is going to across the board is going to be a risk factor for every patient. I'm like, there's nothing good that cigarettes will really bring you other than like being a temporary medication for whatever you're dealing with, because it's going to be a risk factor for heart disease, multiple cancers is going to cause it. So I'll touch on that a little bit more once we start breaking down some of the cancers. But like, yeah, that's definitely a big one as well.
It amazes me the amount of people still smoking, and it's like more every day are starting to smoke. It's just crazy. And I've my career over the years, I've cleaned a lot of parking lots. I've cleaned up 50 million cigarette butts, I think, in the life, and it just kills me that these people continue to smoke.
And
Uh,
then if people aren't smoking cigarettes, they're vaping nicotine.
yeah,
It
yeah.
maybe won't cause necessarily lung cancer, but it could still. There've been studies of people having scarring of their lungs from vaping. So I always
Yeah.
want to. It's not a completely, but even though you go on multiple streets and you see a vaping shop, which is, but it can cause you a lot of harm. So just
Hmm.
being mindful of, even if because people will be like, oh, I got a cigarette vape. I congratulate you, but also this is now a new problem we have here.
Yeah. Gosh. Okay. Wow.
Hey, I wanted to touch on blood pressure quick that you mentioned. Again, another pharmacy story from the counter. I had a patient come in total disbelief. My doctor told me I have high blood pressure, but I don't have any symptoms. I don't feel it.
Mhm.
My blood pressure doesn't feel high. Can
Yeah.
you talk about how, I mean, I think my first thought is it goes back to your annual wellness visit. You know, you get checked out and whatnot, but what can you say to patients who maybe have never had their blood pressure checked before or think everything's fine or just, I think you know where I'm going. So,
I think there's always going to be a little bit of shock value when, especially if you haven't seen a doctor in a while, and then all of a sudden you're ending up on all these medications. You're going to be a little skeptical, like, be like, how could I have high blood pressure? Like, I take care of myself. Like, high blood pressure for starts could be genetic. So, like, if your parents have hypertension, you're more likely to develop. It doesn't mean that you're destined to, but you have a higher likelihood because there's people that are completely healthy, take care of themselves, but they still have hypertension. And then speaking to some of the symptoms, sometimes you're symptomatic, sometimes you're asymptomatic. So sometimes you'll have blurred vision, you'll have headache, you'll have dizziness, you'll have maybe chest pain, you'll have sometimes breathing difficulties as well, and then sometimes you'll also have swelling. But then there's some unlucky individuals that will have zero symptoms, and just because you have zero symptoms does not mean it's not affecting the body. It doesn't mean that it's not affecting your blood vessels. It doesn't mean that it's not leading to more plaque, leading to more plaque in your coronary vessels. So there's a multitude of effects that uncontrolled blood pressure can lead to.
Wow. So, what is the most common cancer in females?
So in females, that would be breast cancer. So with breast cancer, I always stress mammograms to patients. I truly believe it saves lives. And right now, screening is you start at 40 years old, unless there's some like family history of breast cancer, kind of changes things. But for the general public, it's 40 up until 75. After 75, make individual decision with the patient, because as you get older and age past 75, the risk outweigh the benefits from the mammogram. But in general, something I recommend. And a mammogram, I'll have my patients get an annual mammogram. Now, it's not the most comfortable exam, but once again, it saves lives. So it's something that I would.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy this morning. We're talking to Dr. Odera Mbanugo.
all right, doctor, we kind of talked a little bit about cancer in females. How about cancer in males? What are the most common cancers in males?
So most common cancer in males is prostate cancer. So that's another big one. Doesn't present later in life, but still important one to catch. Best way, the first initial screening is a PSA level. So with that blood level, I'll start at around 50 years old. And then like annually, I'll just check that. So if it gets to a certain level, so like the cutoff that I'll look for is the lab value 4. So once you're above the lab value 4, it needs to be referred to a urologist for further evaluation and most likely a prostate biopsy. And though prostate cancer is what we call like a slow growing cancer, it still is a major killer in the US, and it can be easily prevented if detected early, just like breast cancer.
Okay. How about the number one cancer related to the cause of death? We've covered the male-female thing here, but is it the same for both?
Okay, so the number one cancer-related death is actually lung cancer. So that brings us back to
smoking.
Can often cause issues. For some people, you could have lung cancer pop up in your 50s. Some people present later in life. Some people, you'll always have that patient that was smoking 2 packs a day and they're completely fine, but you can't make decisions based on another person. So, but in general, you have a higher risk of lung cancer, COPD, of course. If you smoke a certain amount of cigarettes, there's a calculation that I'll do that if you smoke a certain, we'll call it like pack here. So if you smoke what
Mm.
I would calculate to be 20 pack years, and you're between 50 and 80, you're now in the population that should be getting an annual low dose CT of the chest, similar to an X-ray, but get a little bit better picture with that. And the point is to find any concerning nodules that need to be followed up on by maybe a pulmonologist. All right. And if it's a certain, like, let's say you find a nodule on the CT and it's like less than 6 millimeters, you could pretty much treat it as benign. So like there's different, your thought process changes depending on the size of the nodule, but this is information that you'd never get unless you're coming to your primary care doctor regularly and then you're having these discussions about the smoking.
Interesting. Do you find that the insurance companies reject or won't pay for certain pre-cancer or whatever testing? Because I know there's so many areas of the body, that could be cancerous. So
that's a good question. So it's always kind of it's always a battle sometimes with the insurance, but for the most part, if you give good reasoning, then things get covered. So, for example, even like with colon cancer, so normally the screening would be at 45 years old. It used to be 50, now it's 45 years old. But then the caveat is if you have a first degree relative, so if your mother or father had it, then you actually would qualify to get. So like if your dad had it at 46 years old, then you start 10 years from then. So then you can start at 36. So there's ways around getting it earlier if you truly need it. Same thing with breast cancer. And then as far as lung cancer screening, just based on like evidence-based studies, right now 50 is where you have that nice balance of benefit and risk, because you're always going to have like false negatives, and there's always a risk of like you get biopsied and it ends up being nothing, which is good, but then all these things have complications that you're being subjected to. So there's always like a balance when it comes to these testing.
One kind of off the wall question too is, I've been a pharmacist for over 50 years, and I've seen the coffee come and go. Oh, coffee's good for you. Drink it. Coffee's not good for you. Don't drink it. You only drink 1 cup a day. Well, how do you see that as a doctor?
So it really is based on an individual basis. So if you're someone that you're coming in with palpitations, then it'd be best to kind of cut down on the coffee. Or if you're someone that has some type of rhythm issue like atrial fibrillation or SVT and so on, you probably should not be drinking the coffee. If you're someone that struggles with insomnia and you're drinking coffee around the clock, that's likely contributing, and I'll tell you to kind of cut down. So there's a number of like health concerns that people come in, they'll be like, maybe cut off the coffee. You don't have to cut it off completely, but it really depends. The amount that I'll recommend will depend on like what you're dealing with at that time.
What kind of gets me with decaf coffee is it's still got caffeine in it, and it still keeps me awake at night if I drink any after dinner. So I don't do that anymore. So I missed one question too. What is the number 2 cancer-related cause of death?
So that would be colon cancer. And I touched on the screening a little bit. So like I said earlier, used to be 50, now it's 45 years old. I imagine that in a decade, it'll probably move down to 40, just because there's been people getting colon cancer even in their 30s. If anyone watches or keeps up with any of the Marvel movies, Chadwick Boseman, he was a very young man in his 30s, colon cancer, and then he sadly passed. So that was a reminder, I feel like, for the general public that you need to take colon cancer screening very serious.
And he was a fit guy too. I mean, it's not like he was overweight, and I mean, those kind of things just really do kind of make you think. And man,
was he? Well, it's probably not a proper question, but what I was thinking was, has anybody in his family had cancer or anything like that, or don't they know?
You know what? That's a good question. I'm not sure. I'd have to look into that. I'm not sure what his family was as far as cancer.
So, why don't we talk about vaccines a little bit? We've been inundated for the last several years with vaccines, and at least from our perspective in the pharmacy, it seems like some people are kind of sick of hearing about shots. I think lately in the pharmacy, we have patients that still understand how miserable getting shingles can be, and they have friends that have had shingles and they've known how they've suffered, and that seems to be something people are interested in. But I feel like in the last couple of years, the number of people that want to get a flu shot, they're shotted out, if you will. Excuse me. Can you talk about how important it is to be able to be protected against a preventable vaccine?
Yeah, so like once upon a time, there was no vaccines and there was like many illnesses like measles, for example, that would pretty much take out whole civilizations, you know.
Yeah.
Uh, Now we don't think about these things because like it's we don't really think about it, but it's been chronically saving lives for a long time. And just like anything in medicine, prevention is key, and that's the best way to prevent a serious viral and or bacterial illness. Um, and then speaking of flu, usually people will always come up with a specific reason for not taking the flu or another vaccine. Some of it will be like a personal experience or experience of a family member or friend. So like they might be like, last time I took the flu, I got the flu, which is incorrect because the flu virus or the flu vaccine is what we call an inactivated vaccination, which means that the virus itself is actually dead. So you really can't technically get the flu virus. But what is doing is that your body is recognizing that there is a dead virus in your body. So it's mounting an immune response. And the beauty of that is that next time you actually come in contact with someone with the flu, now you're able to fight off the illness without actually getting knocked out essentially for 5 days. Now, you're gonna have some people that will be more sensitive to the immune response might be more strong. So it might feel like you're getting sick, but you're technically not really getting sick. You're just having a stronger immune response. And chances are the next time you're probably not gonna really get that bad of a sickness from the flu.
Interesting.
And then
So go ahead.
and you also have people that'll be like, I got the flu vaccine or I got the COVID vaccine and I still got sick. Now, with any of the vaccines, it's not going to be 100%. You're just trying to put yourself in the best position to not get sick. You might still get sick down the road, but you're trying to increase your chances as best as you can.
Okay, time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. The Medicine Center Pharmacy, Brad and I are joined this morning to bring you the doctor. I thank you for joining us. Let's get back to the last segment of the show.
All right, we were talking about vaccines, and maybe, doctor, it'd be helpful to learn what you feel are the most important vaccines. If you feel like you have vaccine fatigue, like we were talking about, let's talk about the ones that are the most important to get to make sure you got the best chance of having coverage.
Okay. So with the flu vaccine, it's not always a benign illness. And it's not for some people, it's not just you have to call off work for 4 days. Some people actually get hospitalized. You get a viral pneumonia. It's been known that if you have pneumonia from flu, you could have a staph-related pneumonia, which could be serious, and get hospitalized for that. And then you could even be infected with multiple things at the same time. RSV is now on the rise in adults, like in the elderly, to the point that now they've now been trialing a vaccination for RSV. And then even though things have somewhat normalized with COVID, like COVID is still causing issues here and there. So that's an important one to get. That one's the most common one where people have probably the most fatigue about it, just because like we're dealing with that virus for such a long time that people just kind of got fed up with everything. Now, you spoke about shingles. Shingles is one that I notice is people are becoming more accepting of because of they saw someone get it. And when they see someone experience it, they don't want to have that type of pain because it is
Yeah.
a very comfortable situation to have. And I'll always explain to people that shingles is essentially, you had chicken pox when you were a kid because they used to have like was it like the chicken pox parties, and then you
Okay. Okay.
okay, so you come from it, you think you're in a clear, when in reality the virus actually goes dormant into your nerve cells, and when it could be you're stressed out or something, and like when you're 50 plus, you're at higher risk of getting that rash. But this time the rash is like it goes on a almost like a strip pattern, and it causes severe pain. But then also you could have, if you're the unlucky one, you could have shingles that affects your eyes, affects your vision, and you have shingles that affects your ears. Like if anyone heard about the story,
Jeez.
Bieber had a rare case like in a young adult where he had Ramsay Hunt syndrome, which essentially is the shingles virus affecting your the main nerve in your ear, essentially. Okay, so that's another example of why it's important to kind of get the shingles vaccine, and then another one I'll say will be the pneumonia vaccine as well.
Mm.
So if you smoke cigarettes or if you have any heart failure, chronic lung disease of any kind, if you're immunocompromised, it's an important one. If you're 65 plus, it's indicated to get the pneumonia. And the latest one is the Prevnar 20.
To complement your delivery there, doctor, I think that you mentioned something that everyone needs to think about too. And you mentioned when your body's under stress. And I've always felt like shingles is like that opportunistic thing where when you've had it all, we've had patients in the pharmacy, they had a death in the family, they got a cold, they're trying to run the house by themselves, or their family member is in the hospital. I mean, when all those things crescendo, it's like shingles pops up and says, it's my turn now. And I feel like, just like you said, I mean, it could be any situation. It could be a situation with any illness and pneumonia too. So I just don't discount those things that happen. Put yourself in the best position you can to protect yourself, because you can't predict some of these things.
Mhm.
Um, so anyway, let's talk about specialists. Aultman has a enormous amount of specialists beyond your specialty. Can you talk about how you guys work together to help patients when they have a need that is complicated and you want to make sure they get the best level of care?
Okay, uh, so primary care in general, you're going to be essentially the quarterback. You're going to be like just coordinating care a lot, because a lot of times the cardiologist might not be on the same page as the nephrologist. Like anyone that's trained in medicine, there's always a joke of like the cardiologist puts the patient on Lasix, but then now nephrologist is pissed off because now the kidneys are going down. So but that's just an example of like they could be they're focused on one thing, another person might be thinking another body system. We kind of bring it all together, because when someone comes into my office, I'm kind of taking into account everything, where normally I might start medication for this person, but I'm like, we shouldn't start it for you because it could affect this organ or it could lead to this down the road.
I've one thing I want to touch on quick too, and I know we're running short on time because I don't want to miss anything that's important to you, but every once in a while we get a patient that comes in the pharmacy and they say, well, this doctor I went to another doctor, they put me on more medications. I don't think any doctor wants to put you on medications personally. They're trying to do what they believe is the best in your best interest as a patient. I mean, they've got years and years and years of study, and they're basing their guidance on the best practices that medical knowledge has now. And sometimes if you have more than one blood pressure medication, you have stubborn blood pressure, and they're just trying to help attack that problem from different ways. So don't be afraid to ask us, the pharmacist, you know, is there anything that's a duplication? Because we could talk about that. It happens occasionally, but so often you guys work together to find solutions for patients in the best way you can. And sometimes it means more than one medication. So I just wanted to throw that out there. But um, So, doctor, I think it's important since we're running tight on time. What are you most passionate about in family medicine?
So, when it comes to my passion about family medicine, it's essentially getting to know the people on a personal level. I feel like unlike any specialty out there, you really get to know about like their family, their what brings them joy in life, the things that they're scared about. You're usually the first person to hear about like a death in the family, or if they're going through a bad divorce slash breakup. Um, a lot of times, though we're not a counselor by trade, you end up doing a lot of counseling where you're kind of like working them through their problems, you know. So I definitely find enjoyment in that. It's definitely very unique to our field. And then just that continuity of being able to kind of watch people progress. Like you might see someone on day one, and 3 years later, like the growth that they've shown with just their management of their care, or like maybe they lost weight over the last 3 years and they put in the work. So it's a very nice thing to be able to see.
Do you have a favorite story you'd be interested in sharing about something that you felt was really rewarding to be a part of?
So I always think about a gentleman that I managed when I was a resident that he had big issues with alcohol, and he was someone that I felt like everyone kind of gave up on him because he was coming into the hospital over and over and over and over again. And then I just kept seeing him like almost on a monthly basis just to kind of check in on him and kind of see how he's doing. And then over time, it was becoming apparent that he was depressed, and that's why he was drinking, and that's why he wasn't doing his diet. That's why he wasn't taking his diabetic meds. And then once we got his depression controlled, then he started taking, then he started getting hospitalized less frequently, which is good for patient, cheaper for hospital. And then on top of that, he started taking all his medications, and then his A1C improved drastically. And that was just based off of just listening to what he's struggling with, because he didn't really have any family to really support him. So a lot of like I felt like pretty much I was kind of it for him, you know, because a lot of people gave up on him because he just was just looked at as kind of like a bad apple, just abused in the ER. And then I kind of stuck with it, and by the time I left residency, pretty much was a new man. So
And I think that story there alone personifies how important it is to have a primary care physician. I mean, you guys built trust, you worked together, and you got him to a better place. And that's awesome. Well done. Well done. Doctor, before we wrap up, could you list maybe some contact information for your practice and how people listening today can get in touch with you if they'd like to seek out care?
okay. Are you talking like the phone number, address? Okay.
Yeah.
Oh, okay. So my office is AMG Canton South Medical Center. We're off of Cleveland Avenue Southwest. We're right by Canton South High School. That's probably easy to find us. Like we're right next door. So if you need to contact our office, our number is 330-484-2584. And I am me and Grace Snyder are accepting patients. So come on by.
Excellent. Well, doctor, we appreciate you very much and what you do for the community and taking time out of your busy morning to share with us everything that you do at your practice and what's important to you in the community. To our guests, Odera, Mbanugo, thank you. If you suspect you have a medical issue, please contact your healthcare provider. Thank you to Aultman Health Systems and our listeners for joining us today on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you right here on News Talk 1480 WHBC next Friday. Thank you very much.
All right. Thank you for having me.
Thanks, doctor. Have a great day.
All right. Take care.